Hello. Just reading an exceptionally well-written book here. My name is Dr. Alex Watson, and I get people ready. In all seriousness, by that I mean that I get people ready for cancer therapies, surgeries, athletic performances, body composition goals, whatever it takes that involves metabolic health, exercise, physical medicine, rehabilitation, combining all those skills with hormonal optimization, and a little bit of deadlifting passion. In this video, I'm going to teach you or your loved one everything I know about getting ready for cancer therapy. My number one goal? If I can make one person a little less scared, a little more confident, a little more focused on the long game, getting back to that life after cancer therapy, I'm a happy doctor. You may be thinking, dude, read the room. I agree. A new cancer diagnosis is serious. But my guess is you've got enough serious people around you. They'll help you with the main fight. I'll teach you how to be a formidable prize fighter. There's one more thing I want to address ahead of time. I'm going to discuss nutritional adjustments, exercise habits, and things like sleep optimization that actually may reduce the risk of cancer progression and recurrence. In the same way, this unfortunately does not mean those things are guaranteed to stop cancer's progression. It also doesn't mean that by neglecting them, anyone caused cancer in the first place. Smoking raises the risk of lung cancer by roughly 20 to 30%. But notice I didn't say that smoking causes lung cancer. Even if lifestyle factors like diabetes, smoking, poor sleep, alcohol use may increase the risk for cancer, in the end, something else had to actually cause it. And that thing is usually bad luck. Bad luck with the match, not anything you or any person that has cancer did to actually cause it. So let's put that one aside. Now, that being said, to fight your hardest for the next few weeks, months, or years, treat your body the best that you can. Sometimes this may require more strength than you're able to give at a certain moment, and that's okay. Do what you can. But on those days where you've got fire in your belly, dig down deep and give it your all. Make the most of those days. Let me show you how. All right, so now why is it worth listening to anything I have to say about this? Is it the promise of my adorable 4-year-old popping up somewhere in this video?
Can you say prehabilitation?
Pre, pre,
Prehabilitation.
Prehabilitation.
Try it again. The camera. Ready? Say pre.
Pre,
Look at the camera. Not loud at me. Pre.
pre,
Hub.
huh,
Ilitation.
irritation.
Prehabilitation.
Prehabilitation.
Is it because you're inspired and want to fight like hell?
You've got this.
You got it.
Look at the camera.
You got it.
So that's why you're here. I'm here because I'm a physician who specializes in prehabilitation, with the training to put me here. I'm board certified in both physical medicine rehabilitation and obesity medicine. Then, to crystallize that training into one prehabilitation authority, I co-edited and was an author in the first textbook on prehabilitation for all medical procedures. And I also published a companion handbook for patients. This one. That might look familiar. I will teach you the richest, most applicable insights from both of these books, as well as any new information we learned since then. This field is continuously improving. The final disclaimer is the most important. Unfortunately, at the time you're seeing this, I'm probably not your personal physician, so nothing in this video is meant to be medical advice. This is only for educational purposes, and you should never delay or defer evaluation or treatment for any medical condition based on this video. Please consult your own personal medical team before trying anything in this, as this is for educational purposes only. Now, if you ask 3 different medical professionals what is prehab, you could easily get 3 answers. These guys use it in the therapy sense, meaning to target certain weaknesses or movement patterns with training to avoid injuries later. Some folks may liken it to the enhanced recovery after surgery protocols. These protocols focus mostly on the few weeks around the procedure, prioritizing things like pain control and perioperative nutritional management, etc. For me and the colleagues in the textbook, we broke it into 3 pillars: exercise, lifestyle, and neuropsychiatric. Exercise is what it sounds like. Lifestyle includes nutrition, supplements, and targeted weight loss treatments. And neuro/psych deals with pain, mood, sleep, and related afflictions. Even among people like me, there isn't any official consensus on the breakdown for prehabilitation or pillars or anything like that, but I bucket it like these because it makes it easier for discussion. Prehabilitation research shows all kinds of benefits, but sometimes lack thereof. The biggest reason? no one can agree on how to do it best. Generally, though, according to this random assortment of studies, prehabilitation for cancer therapy may build muscle mass and improve function so that physical capability after cancer treatment may actually be at a higher baseline than before prehab even started. Prehabilitation may improve maximal oxygen consumption, which is aerobic capacity. It can reduce postoperative complications like pneumonia and lung collapse after thoracic surgeries, like after a lung cancer surgery, for example. It can reduce other infectious complications and hospital length of stay by optimizing nutrition in patients with colorectal cancers and reduce anxiety and depression during cancer treatment overall. My summary here: prehabilitation works when the intensity of the effort is adequate and the overall approach is comprehensive. This means that it feels too easy? Probably is. The flip side is, it's a lot easier to work really hard for something when A, it's for a relatively short, defined end period, and B, there's a chance for significant benefit afterwards. Alright, so who is this video for? This overview is for patients and families with a new cancer diagnosis, or really anyone who just wants to know all they can be doing to potentially reduce their risk for developing cancer. The metabolic interventions that I'll describe later may lower risk for cancer progression, recurrence, and even incidence of new cancers, since metabolic disease is a major risk factor for many kinds of cancer in the first place. Some of the most common cancers that do have a metabolic contributing factor here will be breast cancer, endometrial cancer, prostate cancer, pancreatic cancer. The list kind of goes on there. So getting your best metabolic health ahead of time will make you both respond better to treatments, feel better during them, and again, reduce the risk for recurrence or new cancer development potentially. When's the best time to start prehabilitation? Immediately. The longer you have, the less intense it needs to be to achieve the same outcome. So short prehab programs can work. Usually the minimum is around 4 weeks. But those need to be pretty intense, much more so than an 8-week program. I'll describe later what the different variables for intensive means. But to provide a little more detail from the prior intro, the pillars of prehabilitation cover areas of physical conditioning, lifestyle modifications and nutritional optimization, psychological support, and then some medication optimization that doesn't really fall into one of those buckets there. So let's understand the broad frameworks of each, then later we can get a better handle of the actual plans of attack that I'll be recommending. Recommending that you look into, of course, because, again, not medical advice. All right. So physical conditioning refers to different exercise strategies, which in cancer prehabilitation include strength training, different styles of aerobic training, balance training, and then also some specialized tissue resilience training, such as isometric exercises, because those will support tendon and ligament health. And even if you have a dedicated prehab purpose for cancer therapy, you can still get normal run-of-the-mill musculoskeletal injuries, and we don't want one of those on top of everything. For nutritional optimization, approaches kind of vary. I look at this the same way that I approach any form of a metabolic health nutritional program, with a few unique features. Most individuals in this country are struggling with their body weight, and many also have low muscle mass at the same time. That's a condition called sarcopenic obesity. For these reasons, weight loss is not always the absolute goal during cancer therapies. Instead, we aim to burn body fat while increasing muscle mass. Isn't this kind of everyone's goal in the first place anyway? I'm willing to miss out on greater weight loss in order to preserve that muscle mass, because that is valuable real estate that you don't want to give up too easily. Losing muscle is significantly more impactful during cancer prehabilitation. But other nutritional factors that we want to explore are supplements for overall benefit like creatine and whey protein, slightly more targeted benefits like fish oil, and then case-specific benefits of things like collagen, peptides, magnesium, other things like that. The psychological support aspect of prehabilitation is especially unique and important during cancer prehab, given the number of cancers associated with lifestyle choices. For patients with cancers associated with obesity, smoking, alcohol consumption, and others, we end up having to deal with both the overall adjustment issues, so coming to terms with the new diagnosis, and the guilt or stigma of having done it to yourself. If we're able to reduce these feelings of guilt and the associated depression, treatment outcomes are significantly better. Part of this overall psychological support involves treating insomnia, acute and chronic pain, and any other psychological afflictions that will negatively impact participation in prehab, as well as the sleep and the recovery from exercise. Now again, of course this is easy for me to say, but even if lifestyle factors like drinking, smoking, difficult to control diabetes, all those things increase the risk for cancer, folks should not feel stigma, shame, guilt, all those things. Cancer still happens from mutations and from random exposures and random bad luck. So getting past that stigma is easier said than done, but at the same time, it's an important part of being able to move forward and fight your hardest during this cancer preparation and treatment period. All right, moving on. So medication optimization is going to be very person dependent. Besides the obvious changes for the above conditions we mentioned before, we'd also like to make some basic changes that can independently benefit metabolic health. I often first take aim at blood pressure medications that I believe can probably be doing more for the patient than just lowering blood pressure. On the other hand, some of them might not be best selected for the condition. For example, one of my larger pet peeves is when somebody's on a selective beta blocker like metoprolol for blood pressure management when they don't have any other conditions that would necessitate that one. Why is that relevant? Because otherwise metoprolol is just fairly inadequate for blood pressure control. I mean, the studies show that it only drops it 5-10 points tops at the highest doses. It really just increases the patient's intolerance of exercise activity because it deliberately suppresses the heart rate. So you can't exercise more vigorously, and your blood pressure is kind of controlled. Now, oftentimes it's also lost opportunity for using medication like telmisartan. That can have a stronger impact on blood pressure than metoprolol, but also has unique features that can increase fat burning and metabolic health by stimulating the mitochondria in our cells to develop and burn fat a little bit more effectively. Of course, any sort of medication recommendations are going to be very personalized, and so this is, of course, very difficult to personalize all the recommendations for if this, then that, or take this, not that. But basically, you want to be focusing on any sort of medications that may be causing short-term issues on blood sugar control or exercise participation or negatively impacting sleep, even if it has a well-intentioned other purpose, main purpose. But really, if you can find medications that may even sacrifice some long-term benefits, so not in the medication realm, but ketogenic diets, they can control blood sugar very well sometimes, but notoriously may raise cholesterol. Well, cholesterol is not our major concern here for a 6-week prehab period, so we might deal with that later while improving things more aggressively now. Thank you sincerely for hanging with me through all those details. Again, please like and subscribe so others can find this resource during their cancer journey. If not already, the next video should be up within a week, and that one will be covering some of the research-proven benefits of prehab that still surprise me sometimes.